Welcome! I sure love it that you've come back for more education on menopause in general and breast cancer in particular. This is what I like to call Menopause University. I've turned my YouTube channel into a classroom. And if you're a student here, you will get the best education on menopause ever. Actually, it's the only education on menopause ever. Everything else available to you is bias, advertising, marketing, coercion, or terrorism. My goal is to give you accurate facts. How you use them is entirely up to you. So, last week, I gave you an introduction to the big list of risk factors for breast cancer. And today, it's time to delve into that list and discuss each item individually, one video at a time. And this is the first of those videos. So here's the whole list that I showed you last week. The very first item on the list is a genetic mutation for breast cancer, but I already presented that in video number 368. So this is video number 370, and it's on your personal history of cancer as a risk factor for breast cancer. Now, in my book, first and second editions, this material is in chapter 30, all of which is on breast cancer. But I do not go into detail about personal history that you'll get in this video. Now, most women think they know the meaning of personal history. But I have found that most women are mistaken in both the meaning of personal history and in how they utilize that history to manage their menopause. I've also discovered that women fail to distinguish between their own personal history and their family history. The two are hugely different. So take advantage of the fact that I'm going to really clarify both in these videos. What I'll do is present everything you need to consider when addressing your own personal history as a risk for breast cancer. And we'll make a flow sheet as we go along. I like flow sheets as much as I like charts. So here we go. The very first thing to ask when it comes to your personal history is, personal history of what? In other words, what medical conditions in your past put you at higher risk of breast cancer in your future? When it comes to your personal history, let's go from the general to the specific. In general terms, it boils down to a basic principle. If you have ever had any kind of cancer, you are at higher risk of having other kinds of cancer. The motto we use in medicine is once a cancer patient, always a cancer patient. Now, why is that? Well, it's because your body has already demonstrated a propensity for developing cancer. It's like the familiar saying, history repeats itself, or the quote, the best predictor of future behavior is past behavior. So my motto for every patient who has ever had any kind of cancer is, everything is cancer until proven otherwise. I can't tell you how many times I've diagnosed cancers that have nothing at all to do with my specialty. And it's not because I'm clairvoyant or smart. It's simply because I always adhere to that motto. I once saw the dean of my undergraduate university, Rice University, at a social event years after I graduated from both college and medical school. And I knew that he had had cancer. And as I stood there speaking with him, I noticed a very tiny mole on his face. And of course people have moles, and I didn't know him well enough to know about all his moles. But that mole just bothered me. So I asked him about it. And he shrugged and just said, "Oh, it's aging." But I persisted. "Well, you're not old, and that mole doesn't make you old," is what I said. And then I put my hand on his arm, and I looked him squarely in the eye. And I said, "But please promise me that you'll go to a dermatologist to check that out." And I didn't see or hear from him for years. There was really no reason I would. But about 4 years later, he saw me at another gathering. And when he did, he excused himself from the conversation he was having with his colleagues, and he crossed the room to approach me. And when he reached the circle of people with whom I was talking, he said, "Please excuse me, but I have to hug this woman. She saved my life." And he parted the circle and gave me a heartfelt, long hug, followed by a kiss on my cheek. And then, to explain himself to both me and the onlookers, he patted his cheek with his finger and he said, "Dr. Taylor saw a tiny mole on my face and made me promise to see a dermatologist. And it was a melanoma. And the dermatologist said she saved my life because it was a very aggressive type. And if I hadn't caught it so early, it would have been fatal." Well, more correctly, if she hadn't caught it so early, it would have been fatal. I will be forever grateful to her. And the colleagues he had left across the room had come to see why he had departed so abruptly, and they had attracted other people's attention also. So before I even realized what was happening, I was the center of attention. Needless to say, I didn't want to be the center of attention. But saving his life was definitely worth it. And I can think of numerous other times when on pelvic exam, I had noticed a mass that was definitely not gynecologic, but a mass, none the same. And when I asked about it, the patient would say, "My oncologist says I'm clear," but I would persist. Once a cancer patient, always a cancer patient. That mass is cancer until proven otherwise. Heck, a sniffle is cancer until proven otherwise. So you go back to your oncologist and you make him or her prove to you that it is not cancer. And on several occasions, it was cancer. And the patient would always be surprised that I, their lowly gynecologist, rather than their oncologist, caught it in time. So if you have ever had any kind of cancer, you are at risk for other cancers. And face it, all cancers have a list of risk factors that determine your likelihood of ever getting that cancer. And many of those risk factors have to do with your diet and lifestyle choices. And many of the diet and lifestyle choices that increase your risk for one cancer also increase your risk for another cancer. So you have to contemplate why you got cancer the first time. So let's create our flow sheet as we go along. It'll be much easier to follow it that way. Here you see our topic, which is personal history as a risk factor for breast cancer. That's the title of our flow sheet. Then you see that risk factors for cancer can cause any kind of cancer. So this is just a start, and it's very, very general. Okay, so now for some more specific things. There is a whole host of gynecologic cancers, and there are many different kinds of breast cancer. Do they all increase your risk of breast cancer specifically? No, they don't. Only certain cancers specifically increase your risk for breast cancer. When it comes to your personal history of cancers that specifically increase your risk of breast cancer, there are two cancers of great concern: breast cancer itself and ovarian cancer. I'm going to start with ovarian cancer because it's more straightforward. If you have had ovarian cancer, you are at higher risk for breast cancer. Now this entails only malignant ovarian cancers. Do not extrapolate and include benign ovarian cancers, simple cysts, ovarian enlargements, or endometriomas. It is only the true ovarian malignancies that count here. I know we haven't gotten to our unit on ovarian cancer yet. It will follow this big unit on breast cancer. But many of the risk factors for breast cancer are also risk factors for ovarian cancer. And because of this overlap in risk factors, if you are at high risk for one, you are probably also at high risk for the other. So a personal history of ovarian cancer is a risk factor for breast cancer. And remember, this only pertains to you personally. We are not talking about any family members. Stay focused on just you and your medical history. It's shocking how some women will talk more about their family than they do about themselves when providing medical history. Or it's shocking when you say, have you ever had such and such? And they'll say, no, but my mom has. Come on, you are you. Now, ovarian cancer can be hereditary or non-hereditary. So distinguishing between the two can be important in determining your personal risk of breast cancer. In general, a hereditary cancer always carries more risk than a non-hereditary cancer for being a risk factor for breast cancer. This is definitely true of ovarian cancer. So if you've had a hereditary ovarian cancer, it carries more weight as a risk factor than a non-hereditary ovarian cancer. If we now add ovarian cancer to our flow sheet, we get this. Now I've added a personal history of ovarian cancer as the second aspect of personal history that is a risk factor for breast cancer. And I've drawn an arrow from risk factors for cancer to ovarian cancer. I've also divided ovarian cancer into hereditary and non-hereditary categories. Now, the third personal history of importance is a personal history of breast cancer. If you yourself have had breast cancer already, it puts you at an increased risk of having it again. Breast cancer begets breast cancer. And when it comes to breast cancer, there are two things to consider. The first is that you have to assess the risk factors that contributed to your first breast cancer. In other words, why did you ever get breast cancer in the first place? Was it a hereditary breast cancer caused by a gene mutation, or was it a non-hereditary breast cancer caused by other risk factors? In video 367, you learned that hereditary and non-hereditary breast cancers are quite different. So let's go ahead and add this to our flow sheet before addressing the other consideration. Now our flow sheet shows a previous history of breast cancer as a risk factor for a second breast cancer. And it can be either hereditary or non-hereditary breast cancer, just as you saw with ovarian cancer. Now, one of the most important things to distinguish when you talk about a second breast cancer is whether it's the same breast cancer that has come back again, or whether it's an entirely new breast cancer. Of course, we have special medical terms to distinguish them. We use the terms recurrent and primary. Recurrent breast cancer is when the very same breast cancer that you had before returns. It's the same cell type with all the same features or personality traits that your first breast cancer exhibited. Most commonly, it just never went away completely. Either some cancer cells were never removed surgically, or the treatment used to destroy them did not destroy them completely. A second primary breast cancer is when an entirely new breast cancer develops from scratch. It may or may not be anything like the first one. It has nothing to do with the first one. You just had two separate, unrelated breast cancers. So let's add this to our flow sheet. You can see that I've drawn two more lines emanating from breast cancer. And I've added color coding so that you can see the separation of hereditary versus non-hereditary breast cancer in green and second primary versus recurrent breast cancer in turquoise. And now you have to consider something that's going to shock you. As odd as this sounds, you have to be sure that you really had breast cancer in the first place the first time. I know it sounds crazy, but it's reality. The fact is that so many women who had pre-cancer of the breast have the misconception that they had actual invasive cancer of the breast. They were coerced into believing they had invasive breast cancer. They received treatment for invasive breast cancer, and they've been labeled with the fuchsia letter B, just like the scarlet letter A in the story The Scarlet Letter. In video number 362 on carcinoma in situ, or CIS, of the breast, I taught you that carcinoma in situ is pre-cancer. It is not invasive cancer. And there are two kinds of CIS: lobular carcinoma in situ, or LCIS, and ductal carcinoma in situ, or DCIS. These are both non-invasive, not yet cancer diseases. They are considered benign breast diseases, which I discussed in video 360. So be very specific about whether or not you really had breast cancer in the first place, the first time, before you go counting a personal history of breast cancer as a risk factor. This is one of those things that has made the world of breast cancer so incredibly distorted. Here we are talking about your risk of breast cancer based on your risk due to a personal history of breast cancer. And the bottom line is that if you never really had breast cancer in the first place, then this risk factor doesn't apply to you. So now we'll add this to our flow sheet. So regardless of whether you have a second primary or recurrent breast cancer, you have to ensure that your first cancer was really breast cancer. Of course, the next thing to take into account, if you did indeed have breast cancer, was what kind of breast cancer you had. There are many different kinds of breast cancer. Back in the unit on cancer in general, I taught you that every cancer begins with just one single cell that loses control and grows in a disorganized, excessive manner. So the kind of cancer that results depends on the kind of cell that lost control. Well, your breasts contain many different kinds of cells, which means there are as many different kinds of cancers as there are kinds of cells. I've also taught you that cancers have personalities, and the personality of a cancer dictates everything about the cancer. So some breast cancers are more likely to recur than others, and some put you at risk for new primary cancers more than others. So knowing the kind of breast cancer you had is absolutely vital to making management decisions for both prevention of another cancer and your menopause in general. So let's add that to our flow sheet. Now you see that you have to know what kind of cancer the previous cancer happened to be. Next, once you've determined that you did indeed have breast cancer in the past, you have to decide if you want genetic testing for it. Now, in video number 367 on hereditary versus non-hereditary breast cancer, you learned that there are two types of genetic testing for breast cancer. In that video, you learned that most people get genetic testing for hereditary breast cancer before they ever have breast cancer. But now we're talking about the risk factor of already having had breast cancer. And you want to know if the breast cancer you had in the past was due to a gene mutation or not. So in this case, you are doing genetic testing to assess your risk of a recurrence of the cancer you've already had or the risk of getting a second primary. You are testing for increased hereditary susceptibility to another cancer that becomes a recurrence or a new primary. So to rule in or rule out a hereditary breast cancer, you want to determine if you have a mutant gene that you inherited from one of your parents. Such a gene would be present in all your cells and in all your organs. It would increase your risk of getting another cancer more than if you do not have a genetic mutation. And each of your children would have a 50% chance of carrying that same gene. So genetic testing that reveals a hereditary breast cancer gives you information that is not limited to just you. It affects your children. It also affects your siblings, because if you do have a genetic mutation for breast cancer, each of your siblings has a 50% chance of carrying the same gene. With genetic testing for hereditary breast cancer, once a specific genetic mutation is identified in one person, everybody else in the family can be tested for just that one mutation. So genetic testing for hereditary breast cancer is for a specific gene mutation. And what if no genetic mutation is found? Well, then you have to consider genetic testing for your particular breast cancer. And then you are testing for the genetic features of that particular cancer itself. You want to determine the personality of that cancer so that you can make decisions about your treatment and anticipate your prognosis. These mutant genes will only be present in the cancer cells of the one organ where the cancer began. And the genetic testing says nothing directly about your hereditary risk of getting that or any other kind of cancer, but it does help dictate treatment. This is the kind of testing that would determine whether your breast cancer is hormone receptor positive or hormone receptor negative. It might indicate your overall risk for a particular recurrent breast cancer or a particular new primary. It might predict your prognosis. So genetic testing for a non-hereditary breast cancer is for that specific cancer. I think the key to deciding whether or not to get genetic testing, or any other kind of testing for that matter, is to know in advance how you would use the results. Only test for something if you're going to use the results to guide your treatment or to make decisions. Don't undergo a test, get the results, and then wish you hadn't gotten it because you didn't want to know what it told you. When I was practicing obstetrics, I always warned my new obstetric patients that later in the pregnancy I would be offering them testing for neural tube defects and Down syndrome. I told them to think about it and to discuss it with their spouse to decide if they wanted it or not. And I explained that if the results show a high probability of a neural tube defect or Downs, there's no treatment, and it doesn't change the obstetrical care in any way at all. Their only choice would be to continue the pregnancy or terminate the pregnancy. And if termination was not an option for them, then they might prefer to not know about the problem. So get genetic testing for breast cancer only if it will give you information that you find useful. If all it's going to do is torment you and make you feel like you got a death sentence, you might be better off not knowing. So let's add this to our flow sheet. Now I've added genetic testing for both hereditary and non-hereditary breast cancers. And I've specified the difference between these two types of genetic testing. Genetic testing for non-hereditary breast cancer is for a specific cancer, for that specific cancer. And genetic testing for hereditary breast cancer is for a specific gene mutation. And finally, we come to prevention. In other words, if you've already had some other kind of cancer, ovarian cancer, or breast cancer, what are your options for preventing a recurrent or new breast cancer? This is important because the options range from simple lifestyle measures to invasive surgical procedures. And with the rampant fear of breast cancer these days, women are getting more and more extreme with their options. If you go back to the long list of risk factors for breast cancer, you see that there is a lifestyle category over which you have complete control. It includes all the following as things that increase your risk for breast cancer: high dietary saturated fat intake, drinking alcohol in moderate quantities, smoking, sedentary lifestyle, and obesity. So how many of these things might have contributed to your first cancer diagnosis, be it some other kind of cancer, ovarian cancer, or breast cancer? And how many of them might contribute to a recurrent breast cancer or a new primary? Oh my, I think we're right back to where we began. We've come full circle. That list of risk factors just keeps haunting us, doesn't it? Let's go ahead and finish our flow sheet. Now I've drawn lines from any kind of cancer, breast cancer and ovarian cancer, to risk factors for cancer at the bottom of the flow sheet. And no matter what your previous cancer history entails, the risk factors for cancer are always at play. And I want to add a bit to the conversation about prevention. In medicine, we use the word prophylaxis or prophylactic for preventive measures. Everything you do in the category of diet and lifestyle to prevent breast cancer constitutes prophylaxis. But there are much more extreme prophylactic measures that are becoming more and more common with all the fear of breast cancer. One of these prophylactic measures is bilateral mastectomy, prophylactic bilateral mastectomy. And this is just what the name implies. Prophylactic bilateral mastectomy is removal of both breasts as a means of decreasing one's risk of breast cancer. This is possible before a breast cancer diagnosis or even after a breast cancer diagnosis, even when the treatment does not warrant such extreme measures. Prophylactic contralateral mastectomy is when a woman with breast cancer in one breast chooses to have the opposite normal breast removed as a means of decreasing her risk of breast cancer. And prophylactic bilateral salpingo-oophorectomy is removal of both ovaries and fallopian tubes as a means of decreasing one's risk of breast cancer. Another form of prophylaxis to prevent breast cancer is to take a breast cancer chemotherapeutic drug, even though you don't have breast cancer. All of these are very personal decisions. The key is to know that the spectrum of preventive measures is vast. As we go forward, in order to put things into perspective, I'll give you the relative risk of each risk factor as we address them in the individual videos. Remember, relative risk is the probability of breast cancer occurring in women with that risk factor compared to women without that risk factor. It is not absolute risk, and it is not your personal risk. It's just a comparative number. If it's 1, then the risk is the same for women with the risk factor and women without the risk factor. If it's less than 1, then the risk is lower for women with the risk factor than those without the risk factor. And if it's greater than 1, the risk is higher for women with the risk factor than those without the risk factor. If it's a percentage, it's the percentage decrease or increase of risk in women with the risk factor compared to those without the risk factor. And it turns out that having had a previous personal history of breast or ovarian cancer increases your risk for another cancer by 6.8 to 17.3%. So I'm going to add 2 columns to our chart of risk factors for breast cancer. One column will be for the specifics of the risk factor, and the other column will be for the relative risk of each risk factor. For now, I'll only give you these details for the sections on personal history of cancer and genetics, because these are the only two risk factors we've discussed thus far. I'll add the others as we cover them in subsequent videos. So you can see that a genetic mutation for breast cancer increases your risk for breast cancer by 25 to 85%. And a personal history of any cancer in general, or breast or ovarian cancer in particular, increases your risk for breast cancer by 6.8 to 17.3%. So what I've tried to show you in this video is how your personal history of any kind of cancer, ovarian cancer, or breast cancer can increase your risk of a recurrent breast cancer or a new primary breast cancer. And you've seen that no matter what the specifics of the actual cancer, the risk factors for breast cancer always come into play. If you want a copy of the flow sheet, you can find a link to it in the description box just under the screen you're watching, or you can go to menopausetailor.me. So do you see how much more there is to the line item of personal cancer history? You will discover this same kind of increased awareness with every single video in this unit. Do not assume you know everything. Instead, assume you know nothing, because chances are that you do know nothing. And I always say the more you learn, the more you realize how little you know. That's why I am always a student. So that's it for today. Next week, I'll discuss the risk factor of exposure to intense radiation. And there's more to that than you realize too. Please, please, please go to menopausetailor.me to schedule a consultation. They are more popular than ever, and rightly so. I give you a lot in a consultation. Subscribe, subscribe, subscribe to both my newsletter and this YouTube channel, and follow me on Facebook, Instagram, Pinterest, and Stories. Until next week, bye!